Technical Veterinary Learning Channel, honored by Prof.Ahmed Mamdouh El-Sherif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University, Egypt, presents today. We will discuss, explain, and clarify in 10 series of lectures the subject of epidemiology. In this video, we will talk about the following subjects: meaning of epidemiology, meanings of study, frequency, and distribution. Then discuss meanings of determinants and other health-related events, and explanations of population. This will be described with examples. What is epidemiology really means? The Prophet Muhammad, may God bless him and grant him peace, who was born in Mecca city, present now at Kingdom of Saudi Arabia, at 22 of April 571 after date, and died in Medina city, present now at Kingdom of Saudi Arabia, at 8th of June 632 after date, is the first man who wisely found the law of scientific quarantine. The following statement of Prophet Muhammad, may God bless him and grant him peace, in hadith on the authority of Osama ibn Zayd, may God be pleased with him, for the Prophet, peace upon him, he said, if you hear the plague of a land, then don't enter it, and if you present in this land, so don't come out of it. It is the most modern law of quarantine that applied in these days, especially with COVID-19 pandemic. John Snow, who born at 15th of March 1813, York, Yorkshire, England, and died at 16th of June 1858 in London, as an English physician known for his major studies of cholera, and is widely regarded as a pioneering epidemiologist from the early 18th century on. Epidemiology is a basic science of infectious diseases and public health genomics. It concerned with understanding how animals and/or humans and pathogen genomic variation, all of them affect the distribution of any disease in populations. Here we will explain an example with foot and mouth disease virus, which is a viral pathogen with genomic variations. 7 serotypes were known up till now. They affect on animals and human populations from centuries and resulted in heavy economic losses. So, studying the epidemiology of foot and mouth disease is an important and main target for its control. Another example today is the 6th of May 2020. The SARS-CoV-2 virus, which known traditionally as COVID-19, is the most horrific pandemic from December 2019 up till now. This virus, belonging to Coronavirus family, has 200 mutations up till now, affect all human all over the world, and could be transmitted to different species of animals. So, studying the epidemiology of SARS-CoV-2 is an important and main target to control of it. So, what is epidemiology? Epidemiology is the method used to find the causes of health outcome and the diseases in populations. In epidemiology, the patient is the community and individuals are viewed collectively. By definition, epidemiology is the study, scientific, systematic, and data-driven, of the distribution, frequency, pattern, and determinants, causes and risk factors of health-related status and events, not just disease, in specified populations: neighborhood, school, city, state, country, farms, and global. It is also the application of all of these studies to the control of health problems. Epidemiologists or scientists solve different problems of diseases and or problems in any populations, either for animals population or human population, through study design, collection, and statistical analysis of the data, aimed to interpretation and dissemination of results, including peer review and occasional systemic review. Epidemiology has helped develop methodology used in clinical research, infectious diseases, and public health study, and to a lesser extent, basic research in the biological science. Frequency means the number of times the disease occurs in certain population. So, epidemiology is a quantitative science. Frequency of equine influenza occurrence in Egypt was 3 times as large epidemics. The first time at 1989, second time at the beginning of this millennium, and the third time at 2009. So, collectively, equine influenza occurred in Egypt for 3 times of large epidemics. Frequency of foot and mouth disease United Kingdom since the beginning of millennium was 2 times as large epidemics. The first time recorded at 2001 and the second time recorded at 2007. Knowing the disease frequency will clear the expectation for reoccurrence of any disease in the same place, when, why, and how to prepare the medical authorities for disease confrontation. Frequency of Zika fever disease in South America was 2 times as large epidemics. The first time at 2014 and in the early of 2015. Widespread epidemic of Zika fever reported in Brazil spread to other parts of South and North America, several islands in the Pacific, and Southeast Asia. The second time reported at between 2015 and 2016. Zika disease includes the presence of mosquitoes, so as the mosquitoes abound, as the frequency of this disease will be repeated. Frequency refers not only to the number of health events such as number of cases of Zika, number of foot and mouth diseases, or cases of meningitis or diabetes in a population, but also to the relationship of this number to the size of the population. The resulting rate allows epidemiologists to compare disease occurrence across different populations. Distribution is a descriptive epidemiology of any disease, as it covers time when any disease occurs, place where any disease reported, and host, either animal or man, by means who affected by the disease. So, epidemiology also is a qualitative science. Disease distribution all over the world is very important, as it decided that only one country or several countries have the disease, or the disease will be in a pandemic shape. So OIE cooperate with different governorates of the countries to report and record the disease distribution. This is an example of diseases distribution in Egypt 2019 according to the official cooperation with OIE. Diseases distributed in Egypt at 2019 are brucellosis caused by Brucella melitensis for different domesticated animals, foot and mouth disease in large and small ruminants, as well as rabies was recorded in different animals in Egypt at the same time. Bovine spongiform disease distribution in United Kingdom according to the official cooperation with OIE occurred at 1986 up to 2015. Knowing any disease distribution help the control of it in the place of appearance to prevent occurrence of pandemics. This step is missed with SARS-CoV-2 or traditionally COVID-19, as alerts by WHO come in late time post-pandemic occur throughout the world. Determinants. Epidemiology is also used to search for determinants, which are the causes and other factors that influence the occurrence of the disease and other health-related events. So we assume that illness or any disease does not occur randomly in a population, but happens only when the right accumulation of risk factors or determinants exists in an individual. To search for these determinants, we use analytic epidemiology or epidemiological studies to provide the answers of why this disease occurs and who affected by this disease. So we assess whether groups with different traits of disease differ in their demographic characteristics, genetic immunologic makeup, behavior, environmental exposure, or other so-called potential risk factors. Ideally, the findings provide sufficient evidence to direct prompt and effective public health control and prevention measures. Determinants in open sheep grazing system will be the health status of the flock, the health status of the grazer, as we consider him one of the flock, area of grazing and its disease history. So appearance of any disease in this flock will depend upon the answers of all latter questions we said before. Presence of ticks on skin of this cow answer the post questions. How this cow infected with babesiosis or lumpy skin disease or theileriosis or anaplasmosis and etc. or showing biogenic infection in her skin. And the second question answered by presence of this tick is why all latter diseases may be recorded in the same herd of this cow, as this cow not living alone, it is living within a herd. This picture explains why the person wear a mask. So this due to both questions. Who affected by COVID-19? The answer is all human at any age. So, the contact with direct different excretions of carriers or infected persons will lead to infection to the population. So this leads to the answer of the most important question: why the basic control of this disease in all population is wearing a masks and application of social spacing, especially in gatherings of humans, to protect them from direct contact with the virus. Other health-related events or states. In epidemiology, we focus on all conditions surrounded by any disease. Epidemiology was originally focused exclusively on epidemics of communicable diseases, but was subsequently expanded to address endemic diseases and non-communicable infectious diseases. By the middle of the 20th century, additional epidemiologic methods have been developed and applied to chronic diseases, birth deficit, maternal and child health, zoonotic diseases, environmental health. Then we began to look to the behaviors related to health and well-being, such as amount of exercises done, amount of nutritious that given to the animal in the farms, seed pellet use, number of animals in the flock. Now, with the recent explosion in molecular methods, we can make important strides in examining of genetic markers of disease risk. Indeed, the term health-related states or event may be seen as anything that affects the well-being of a population. Many of us still use the term disease as a shorthand for a wide range of health-related states and events that are studied and occur. Dusty environment as a health-related state which occur in different parts of the world leads to different affections on animal and or human populations, such as respiratory affections, asthma, eye affections, and etc. So, dusty environment act as one of the health-related events. Dragon storm turns deadly after flooding rain and strong winds sweep through Egypt. Floods that reported with this storm will lead to transportation of soil by its contents, including germs, into another areas, and this will lead to appearance of diseases in areas of downstream that not reported before, as well as the areas that have been stripped by rain and wind will show the microbes that existed in the ground, which may have been presented for decades as a result of the burial of the dead bodies of animals, and thus could lead to emergences of epidemics in these places had been recorded for decades. So, changing dramatically in the environment could lead to occurrence of diseases that we not expect. By reviewing the weather map of United States of America in the month of March 2020 and from the knowledge of the characteristics of COVID-19 virus, we can predict the extent of the infections that occur due to the lack of social divergence and mixing between humans on that date, as the temperatures allow the presence of the virus on the surfaces for a long time, and thus this will help to increase the infections. So, other health-related events play a role as the infectious agents completely. By reviewing the weather map of China in March 2020, we will note that it showing lower temperature ranged between 10 to 15 degrees. And from the knowledge of the characteristics of the SARS-CoV-2, we can predict the extent of infections that occur due to the lack of social spacing on that date, as the temperature will allow the presence of the virus on the surfaces for a long time, and thus this will help us to explain why rise of infections in China during that time period. Populations are an important in the epidemiology studying. Populations means the whole number of people or animals or both inhabitants in a country or in a region, as well as populations means the total of individuals that occupying an area or making up a whole. Also, we can define populations as a group of individual persons, animals, objects, or even items from which samples are taken for statistical measurement. In epidemiology, we diagnose and treat communities and or populations, not only a single animal or a single person. In epidemiology, individuals are seen collectively, and the sick animal or human is the whole community. Knowing of populations and disease occurrence in it will lead to control globally of different diseases. In June 2011, United Nations FAO organization confirmed that cattle plague was eradicated globally as a second disease in the history to be fully wiped out. By means it is not present either in domesticated or in wild animals outside laboratory stocks. This following to the first announcement of global eradication of smallpox. Focuses on identifying the exposure or sources that caused the diseases or illness in human or animals, and the number of other animal or persons who may have been similarly exposed, and the potential of further spread in the community or globally, and interventions to prevent additional cases or reoccurrence. So, WHO announced complex Ebola outbreak in West of Africa at 2014 at 2016 at early time. So this disease cannot be called pandemic but restricted to the areas of West of Africa. But controversially, this occurred with COVID-19 when WHO failed and announced early to the pandemic of SARS-CoV-2. So we can see the disaster the world lived with it at this time. Unfortunately, WHO announced SARS-CoV-2 as a pandemic at Wednesday, 12th of March 2020. This is too late date, as this disease reported in human population in China from the late of November and early of December 2019. This leads to the pandemic of the SARS-CoV-2 and the disaster that the world lived with it until now, and we cannot expect the date of ended as it will be 4 years from now. Epidemiology series will be continued at TVL channel, so please subscribe the channel to have the rest of this series.